to Profiles in Quality, an interview program with the leading names in quality management. I'm Dirk Ducharme, Editor-in-Chief of Quality Digest, and your host for this episode. In November 2013, the winners of the 2013 Malcolm Baldridge National Quality Award were announced. Among them was Sutter Davis Hospital in Davis, California. Sutter Davis is a nonprofit 48-bed acute care hospital that offers care in 4 primary areas: medical, surgical, and intensive care, birthing, emergency care, and surgical services. In part 1 of our interview with Sutter Davis Hospital CEO Janet Wagner, we talked to her about the Baldridge Award and the Sutter Davis Hospital's Baldridge journey. I'm doing a little research on Sutter Davis, and I see that you guys are in the top 10% for both MIDAS, that's the Medical Information Data Analysis System, and for the core measure scores from the Centers for Medicare and Medicaid, and actually top of your list for a bunch of other things as well. So how has the Baldridge tied into that? Was this something that you guys have been at the top of your game all along and you've kind of added the Baldridge on, or was the Baldridge part of bringing you to that point?
Mm-hmm. I would say that over the years we have always tried to be in the top 10 percentile, whether it was quality or the patient experience. What the Baldridge journey did for us was focus us, and it gave us a framework with criteria that really kept us on the journey. Actually, they call it a journey, and it is a journey because the process for Baldridge is one where you get a lot of feedback. So were we always in the top 10 percentile? We were striving to be in the top 10% of the country, whether it was quality, service, our workforce. But the Baldridge journey gave us that little extra initiative and really made us self-examine. It's a self-assessment process, and the feedback was incredibly helpful. So
would you say that in the past you guys were doing a good job just kind of organically, and now the Baldridge has helped you kind of codify that? Is that a good way to put it, or?
That's an interesting question. Okay, so what I would say is it started in around 2003 with us identifying the fact that patient satisfaction was important. And even though we are technically very competent in healthcare in terms of providing the care, we weren't really that competent in providing the experience, the patient satisfaction part of it. And so in the early 2000s, we aligned with the Studer Group, and we began to understand behaviors a little bit better at the bedside. Behaviors that led to a better patient experience that would complement the quality of care that we were delivering on the technical side. So our foundation was really understanding behaviors that patients found to improve their experience when they were in the hospital. We married those behaviors with the technical things that we were doing that provided really good care to get the quality outcomes, the clinical quality outcomes. That was the beginning of our journey. Once we realized that we understood the behaviors that would get results in the patient satisfaction arena, we started to look at what could we improve even on a larger scale in terms of leadership, and what kind of leadership did we need that would really continue to provide us with 5-pillar leaders and keep us in that top decile of the country for healthcare overall. And that's when we started to look at the Baldridge criteria.
A lot of people would want to know what kind of investment in terms of time, employee hours, even finances does it take to go after the Baldridge?
I would say the amount of money it takes is to apply, and we didn't really engage any professional coaches. We did use our Studer coach because we had a Studer coach, and Studer does complement the Baldridge journey. So we used our Studer coaches. And the other thing that I did invest in was sending all of our managers to examiner training so that they could understand the process through an examiner's eyes. And that was a minimal investment. It's like sending any manager to a conference.
What part do the employees play in achieving the Baldridge or trying to line the organization up with the Baldridge criteria? Is this kind of a top-down thing from management, or are employees very much involved in the entire process?
I would say it's probably half and half. The Baldridge journey does require everyone to participate in the workforce, the physicians, the workforce, and our volunteers. So we had to get our messaging down all the way to the front line and back. And the way we accomplish that at Sutter Davis Hospital is to ensure that in every department our employees are informed. They know what's important. They know what the priorities of the organization are. They know how they can contribute to those priorities. And one of the key ways, we have a lot of ways that we communicate with our employees every day, every month. But one of the things that we started once we got on the Baldridge journey was to have an all-staff assembly every year, so that once a year, for sure, every employee heard the same message as we were getting, so that everyone knew what we were, the direction the organization was headed in. And they could participate, and they knew how to contribute, which was incredibly important.
Has going after the Baldridge, has that changed your perception of what a patient is?
I don't think it has changed my perception of what a patient is. What's changed is how our team ensures that that patient has a reasonably good experience while they're in our hands. Keep in mind that, different from customers, our patients come to us with illnesses and injuries, and sometimes they're traumatic. And so we were thinking about that entire patient experience, and what happened in the process using the Baldridge criteria and really self-assessing our organization and how we approached patients and families, we began to realize that in fact we did have control over the environment more than we thought we did, and that we could make the experience better for the patients. Actually, you know what it's like? Okay, so where we progressed from was satisfaction, are our patients just satisfied, to an experience. And who provides an experience? Well, Disney does. Disney provides an experience that people remember and they want to go back to. And so we looked at what involves that experience, that climate, that environment, that would make people remember it in a pleasant way. And then we took it even a step further and we said, what can we do beyond just creating an experience? And you know who does that? Ritz-Carlton. So we started to look outside healthcare. Ritz-Carlton's approach is to anticipate their customers' needs. Okay, Disney provides an experience. And then we said, okay, how can we know what happens in a hospital. We can anticipate what people might be fearful of, what they might need, what they might appreciate while they're here. And so we started to look at that whole Ritz-Carlton approach and say, what can we do in our environment that would be equal to what the Ritz-Carlton, or even better than what the Ritz-Carlton is doing, and it's what people don't expect when they come to a hospital.
So you mentioned that part of what you want to do with the patient experience is, you mentioned Disney, you mentioned Ritz-Carlton. Ritz-Carlton was also a Baldridge winner. Can you give me an example of what you mean by that?
Yes, I can. And our staff go above and beyond every day now. They think of things for the patients, with the patients in mind. Just recently we had a lady in ICU who we knew was not going to return home. She had a terminal illness, and she always wanted to travel to Europe to see the European gardens, the wildflowers, the roses, and she never made it. And she shared her story with the staff in the ICU. So the staff in the ICU decided that they would make her dream come true to as close as they could, replicating a trip to Europe or around Europe to see the variety of gardens. And they brought all kind of books in and pictures and things so that she could enjoy those views, those pictures of those gardens, and dream about what it would have been like if she could have actually visited.
Brought it into her
room and made her room feel like an English garden. And those are the kinds of things that touch people's hearts and souls, and those are the kinds of things that you don't normally think the staff are thinking about when someone is in intensive care and they're very, very ill. But those are the things that sometimes make people's lives complete.
Okay, you won the Baldridge Award, and by the way, congratulations on that. I forgot to say that at the beginning, but that's pretty incredible. But suppose you hadn't won the award. Would there still have been value for Sutter Davis in just applying for the award?
Absolutely. There is no question in my mind that every year we got stronger and stronger, and the employee and the whole climate within our hospital, the esprit de corps, the idea that we were getting stronger, that we were taking the feedback, that we were improving. The most important thing is living our mission and improving the care at the bedside. And we were doing that year over year over year. And so even, you know, the whole, I think the journey is not really about being a recipient, although it feels really good to be a recipient. It's very validating. The entire journey has just been a pleasure, I have to say that, both at the state level and the national level. Without the examiners coming to visit us and giving us the feedback that was honest and unbiased, because the examiners are volunteers, we wouldn't be where we are today.
So tell me about the day you found out that you had won the Baldridge. What was that?
We found out in November, actually. We got the call in November.
And does that call come right to you?
It did. It came exactly to me.
So what was that like? You got a call from?
The Secretary of Commerce calls you. Yeah.
Wow.
It is a wow. It was a wow. And you know, the thing is that you know you're going to get the call. Okay, so the Baldridge people are very good about keeping you well informed, so you know you're going to get a call. The difference is who you get the call from. If you're a recipient, you get it from the Secretary of Commerce. If you're not a recipient, then you get a call from another executive in the Baldridge arena. So the call came through, and as soon as the call came through, when it was announced that it was the Secretary of Commerce, I knew that we were going to be a recipient. And it is very exciting. Even though you think it's not going to be exciting,
were you
or
screaming?
You know, well, your heart beats really, really fast. Your heart just goes pounding. And the Secretary of Commerce was just very kind and very complimentary, but it's still a call from Washington, D.C., and it's a thrill. It's definitely.
And what was it like for when you were able to tell your employees?
There were screams then. I mean, there were lots of screams then, and I was like, shh, we're in a hospital, we're in a hospital. But they were very, very excited, and it was, we had champagne, and we were celebrating, because I knew, when I went to tell them, I knew that we were going to celebrate. So, and they were just elated.
Well, Janet, congratulations again on winning the Baldridge. That's the Malcolm Baldridge National Quality Award, one of the 2013 winners in the healthcare category. And thanks for taking the time to join us today.
You are very welcome. Thank you.